Hello, and welcome to the Quality Improvement Training Series. This particular series is about root cause analysis techniques, helping identify causes and solutions. My name is Mary Beth Cox. I am a Quality Improvement Coordinator in the Office of Clinical Quality Management at DBHDS, and I will be your presenter for this series. This is the first of 5 videos in this series on root cause analysis and identifying solutions. The topics that will be covered in this series are listed on this slide. Today, we will be reviewing how to prepare for a root cause analysis. Future topics will focus on root cause analysis strategies and techniques, including brainstorming, affinity diagrams, cause and effect or fishbone diagrams, the 5 whys, a why tree, using a check sheet, a histogram, and a Pareto chart. And finally, we will discuss transitioning from identifying causes to identifying solutions. Let's briefly review the model for improvement, which is the quality improvement model that DBHDS has adopted for conducting quality improvement initiatives. It starts with the 3 questions. What are we trying to accomplish? How will we know a change is an improvement? And what changes can we make that will result in improvement? You answer these by developing your aim statement, your measure, and identifying your change. Then you enter into the plan, do, study, act cycle to test your changes to see if they result in the impact that you desire. In the previous video series, we introduced the focus steps. The focus steps can help support the model for improvement, and in particular, improve your aim, especially as it relates to identifying changes that you can make that will result in improvement. We've previously reviewed how to find an opportunity to improve and organize a team who understands the process. In this series, we will dig in deeper into clarifying the current knowledge of the problem, understanding the cause of the problem, and selecting the aspect of the problem or piece of the process you want to improve. Let's talk about clarifying the current knowledge of the issue or process. This is not clarifying the cause of the problem yet. This is gathering the who, what, when, and where of the problem. This is important because you need to make sure your team understands what the data is and is not telling you. You need to know where you are so you can plan where you're going. Questions that you'll want to ask and make sure your team clearly understands are: who or what is the data or measure referring to? What is the data telling us? What exactly is the problem? What is the numerator and denominator for your measure? How frequently is the problem occurring? How many people are impacted? If it is a health outcome, what is the health issue? If it is a process or a process is involved, how does it work now? Once everybody has a good handle on understanding the problem, then you can proceed with exploring the causes. Let's look at an example of why it's important to clarify the current knowledge of a problem. Say, for example, your team is presented with the problem that the rate of serious falls is the highest incident reported in the serious incident data system, and the rate is 64 per 1,000. It will help the team to also understand that when they refer to serious falls here, that means these are falls that have met the criteria for a level 2 or level 3 serious incident report. It is not all falls that happen. It's also important to understand that the data system referred to here is CRIS, the system used by DBHDS. Finally, it's important to understand that the 64 is the number of reports, not the number of falls, and that the rate per 1,000 is per 1,000 individuals who are on a developmental disabilities waiver. Now we're going to talk about preparing for a root cause analysis. Now that you have an understanding of the current problem, you need to convene a team and plan for how to conduct your root cause analysis. You will need to include people with expertise on different aspects of the problem. These are your subject matter experts. For example, you will want to have people who work with different roles and at different stages of the problem. If your subject matter experts cannot attend a meeting, create a structured way for them to contribute to the process. For example, you can use a survey or interviews to gather information from them about what they see as the causes. Once you have done your root cause analysis, you will want to ask them to review it and give you feedback and their opinion. If your team has been given some information about root causes of a problem, make sure to review it closely. Think about, can you rely on the results that you are looking at? Or is it enough information for you to understand the important causes? Consider doing your own root cause analysis before moving forward if you feel like it's necessary. Consider using the language of root cause analysis in your agendas, your discussions, in your quality improvement initiative proposal, and your plan, do, study, act steps. You could consider using this phrase, we are doing a root cause analysis to explore why this happens, instead of saying we are exploring why this happens. The distinction here is to draw attention to the fact that you are doing an intentional root cause analysis. You may think it's implied, but it's important for others who may review your documentation to understand that this was part of doing your root cause analysis. It is extremely helpful when you are preparing for your root cause analysis to begin with a clear problem statement. By this point, you likely have an aim statement, but this problem statement is a little different. So here are some examples of maybe some problem statements that are not so good, and then how to get to a better problem statement. For example, the question, how do we get more people employed? This is not a good problem statement because it's asking for the solution. It is not the problem. A better problem statement is, fewer than 30% of individuals have an employment outcome. The next statement here, falling is a big problem, is not a good problem statement because it is too broad. It doesn't give you enough details. A better problem statement is, falls are the leading cause of emergency room visits and unplanned hospitalizations for people on a DD waiver. The bottom statement here, I really want my kids to remember to brush their teeth, is not a good problem statement because it's really more about what you want to happen or your desired state or outcome, not the problem. A better problem statement is, most nights my kids forget to brush their teeth. On the right-hand side of this slide, you will see possible aim statements associated with each of these problems. And you can see that the aim statement is a little different than the problem statement. Your aim statement is what you want to achieve, rather than clearly describing the problem. Here are some resources that you may use to get more information about the topics presented in this video. Thank you for watching this video on how to prepare to do a root cause analysis. In the next video, we will talk about the root cause analysis strategies of brainstorming, using affinity diagrams, and the cause and effect or fishbone diagram. I hope you will plan to review that video next.